I'm Dr. Irina Sparks. I'm a radiation oncologist at Goshen Center for Cancer Care. I chose radiation oncology because it's a fascinating field to me that provides many different treatment options to patients that are actually safer for our patients, new technology, new approaches, more convenient for patients, and much better therapies. I also like radiation oncology because this field allows me to form long-term relationship with my patients, and I truly appreciate that. Majority of my patients usually diagnosed with common things such as breast cancer, colorectal cancer, lung cancer, prostate cancer, but we also see more rare conditions such as lymphomas, for example, brain tumors. Any referring provider can send a patient if they have any suspicion that the patient may have cancer, or if the patient has been diagnosed, or even if the provider just has a question that they want us to evaluate. We will work in collaboration with referring providers. So referring provider will always be their specialist, and once the treatment is completed, we'll always refer patient back for continuation of care. We have so many new technologies available for these patients at Goshen Center for Cancer Care that are not available at other nearby radiation oncology departments. Specifically about patients with prostate cancer, we currently offer patients to have spacer placed, which is hydrogel that is get inserted in between prostate and rectum and creates this extra space for the rectum and moves the rectum away from the radiation field. Published research showed that it actually reduces significantly the radiation-induced reactions in the rectum and makes patients much more happier with our treatments. We have this new machine called Ethos, and this new machine utilizes very new technology to give very precise and effective treatment, but on the other hand, we significantly reduce side effects when we're treating prostate cancer patients. The most unique aspect about the Goshen Center for Cancer Care as a whole is that we have a very collaborative environment, and we encourage progressive thinking, and we also invest in new technology, but we're also a very patient-oriented center, and we want to provide the best possible care to our patients. Radiation for one patient is not the same as the radiation for the other patient. We utilize very unique and patient-oriented approach, and my special focus is to offer my patients the radiation that is right for them. The early stage breast cancer can be treated many different ways. The traditional way is to receive radiation every day for 5 weeks, but we also have new approaches such as condensed therapies when we can administer treatment once a day for 5 days. It's called the fast-forward protocol. And the other approach is to give therapy just one time during their surgery, and that's called intraoperative radiation therapy. My personal preference is to utilize everything that Goshen Center for Care has for me, whether it's a new machine such as Ethos, or whether it's a new radiation modality such as stereotactic body radiation therapy, whether it's something more targeted such as high-dose rate brachytherapy or intraoperative radiation treatment, or whether it's something new and progressive such as clinical research. And I think it's just the added benefit to our community to offer those new approaches and new therapies.